Thank you for joining us today, Katie. I'm so excited to have you. This is a new topic for us, and so I can't wait to see where the conversation takes us. But I will start with a little bio. So we have Katie Starrantino. She's a dedicated licensed clinical social worker in Pennsylvania, specializing in couples therapy and relationship dynamics. Katie have a bachelor's in psychology, a master's in social work, and a master's in human sexuality. Wow, that's a lot of degrees. And you're on the faculty at Gwynedd Mercy University, teaching courses in psychology and human sexuality. You also have a clinical practice. Katie specializes in supporting couples and navigating the complexities of relationships, having long worked with older adults and is especially motivated to educate that population about aging and intimacy, and that's why we're here today. And Katie's passion lies in illuminating the profound health and well-being benefits derived from intimacy and connection, inspiring her to educate and empower individuals to cultivate fulfilling relationships. Wow, what a great mission.
Thank
That
you.
is
That was a
wonderful.
mouthful. Way to get through all that.
That's amazing. So I would love to hear what inspired you to go this route with your career and all these things.
Thank you. Yeah, so it's been interesting how I ended up where I am. And where I am, as you mentioned, is kind of a million different places. But I knew I wanted to work in healthcare. I knew I wanted to be a therapist and had a really great professor who told me, get your master's in social work because you can do so many things with social work. If you had gone for an LPC, which is professional counselor, for example, kind of more limited. You can only do counseling. It's harder to branch out. So I did that. I started working with folks with cancer, and I was really interested in the fact that nobody was talking to them about their sexual health, their sexual wellness, their relationships, how the treatments and medications were affecting all those things. So I thought, okay, I might really like to have this special focus in sexuality. And at the time, I was getting my master's in social work. So I just tacked on and got the master's in human sexuality so I could really specialize in that.
Wow. So with those patients and families, would you just notice that from afar that was completely omitted, or would people like bring it up later or try to bring it up?
Yeah, I mean there were a few things. So there would be groups of with the spouses of the people that were living with cancer, and you would kind of hear that a little bit talked about in the groups, just about the strain on the relationship, the changes in intimacy.
Mhm.
And then, of course, working with people that might have cancers that affect parts of the body that we normally think are associated with sexuality, like breast cancer, things like that, that would come up, kind of body image. So it was just interesting to me because we know that these medications and treatments have sexual side effects, but it felt like everyone was shying away from talking about it. So that was kind of my first foray into human sexuality.
Wow, that's fascinating. And I'm sure doing those two degrees at the same time gave you a unique perspective, like equal footing, so to speak, maybe.
Yeah, it was. I did them back to back.
Okay.
And it was good to do them, to have that social work piece right before the human sexuality. And I knew everybody in that sexuality program had different ways they would use the degree, but I knew for me, I really wanted to do the sex therapy work. So it was nice coming right out of the social work program into that.
Great, great. And then I'm curious, your interest in working with older adults in this area, like where did that
Yeah.
come from?
So that was when I graduated with my MSW, Master's of Social Work. My
Mhm.
first job was in a nursing home. And I'll be honest, at the beginning, I really did not think there would be an overlap. I guess, like most people, my brain was just not thinking about sexuality in older adults or intimacy. I really quickly found that not to be true. In my first job, I worked a lot with folks with dementia. And sometimes we'll see that they may not have a guard up when it comes to sexuality anymore. They may say things or act a certain way that they wouldn't have around sexuality. So that was kind of my first understanding of what could happen as you age. But then I moved more into working with seniors that didn't have dementia and kind of learning about intimacy for those folks as well.
Okay, wow, that's fascinating. So, like you mentioned, it's still not talked about,
Yeah.
these topics, sex and intimacy, especially when it comes to older adults. And I'm curious, I have thoughts, but I'm curious, what's your perspective on why do you think this is still so taboo?
I think there's probably a lot of reasons. If we start in general, most of us in this country, sex is kind of taboo. The age doesn't matter, right? So that's the first part. I think it's taboo for many people. I also think that in general, there are certain things that people just don't associate with older adults. And I was thinking about that after I talked to you last, but yeah, there's this idea that like that shouldn't be happening. I think sometimes people almost treat older adults in some ways how they treat children, which I think is very demeaning and ageist. But yeah, so like just like you wouldn't want, some people would shy away from talking to a child about sex. People don't want to talk to an older adult about sex. Also, their children don't want to think about it, don't want to talk about it. Their grandchildren don't want to think about it, want to talk about it. So I think that they have been failed many layers of ways.
Yeah, for sure. And there's all of the cultural, religious stigma and shame that
Huh?
comes with that these topics, which seems like maybe that's decreasing with younger generations to some degree in some pockets. So, in your experience, when you have had these conversations with older adults, what are the kinds of common concerns you hear in terms of sex and intimacy, in terms of what are the biggest challenging areas for older adults?
So I'd say they fall into three buckets: physical, mental, emotional. Physical, our bodies are changing as we get older. So I might hear about things like erectile dysfunction. For women after menopause, might be things like difficulty with lubrication, change in desire, things like that. A mental health bucket, I actually think that could go one of two ways. I do see people that as they get older are more courageous, more
Mm.
inspired to try things that are new. But then there's also that grief, which I guess ties into the emotional bucket as well. Your body might be changing. You may be losing things, and that could be a certain function, or it could be people that you love, a partner that you love, intimacy with friends, intimacy with a partner. So, those would be kind of the three buckets that I see the changes and the challenges in.
I guess I imagine the people that come to you or that you encounter in your work in general, if they bring these things up, they must be those that are more comfortable talking about these things. Are you ever the one to initiate and try to, make people more comfortable and just start the conversation? And how does that go? Or how do you do that?
I sure do. So, there's something you're probably familiar with, the biopsychosocial.
Hmm.
This is an assessment where I kind of get a background about what's happening medically or their biology, psychologically, there's the psycho, and then socially. And I will kind of just let people know about my background. I think them knowing what I've studied kind of opens the door. You can talk to me about it. You can say words that feel uncomfortable to say. They're not going to make me uncomfortable.
Hmm.
So I try to start there because I do think that intimacy, sexuality, that's such a huge part of our biology, our psychology, and our social lives. So I do try to assess that a little bit and kind of open people up. At the same time, different things are important to different people. I certainly see
Hmm.
clients that that's not interesting or important to them, and I would never push it. But I do want to let the clients know that there's room to talk about that if they want to.
That's great. So what would you say are the top maybe three myths that to do with older adults and sex and intimacy?
So I think the first one we briefly touched on, but this idea that you hit a certain age and all of a sudden you're not interested in that anymore. That's not true. Some people are even more confident or even more interested.
Hmm.
I would say another myth is that older adults don't want to talk about it.
Hmm.
So I think a lot of them do. Something that I was thinking about is there's been this push to wellness and longevity, and these are things that I'm really passionate in talking about too. And just like we're talking about nutrition or exercise or all those things, we should be talking about intimacy as a part of that. So I think that there are those older adults that get the value of it and they want to talk about it. I would say probably another myth is that it doesn't impact your health. It's not something that is important for your doctor to talk about, or
Hmm.
that's a huge myth. It has a huge impact on your health.
Tell us about the impact on your health.
Yeah. So I mean, I could go into detail about a business plan I dream of one day, but we'll save that for another podcast. But what we do know about physical touch, not necessarily orgasm, but can be orgasm, intimacy in general, lowers blood pressure. People report a better mood. People sleep better. So, a lot of these things we're prescribing medications for, and we're just taking away the humanness, I think, because it's sometimes easier to do that than to talk to somebody about, when's the last time you've been touched? And that doesn't have to be sexually. That could be like a massage or a pedicure or something. But as we get older, we might be more isolated. We might not have that physical touch. So that's one thing I think a great deal about.
We know that newborns will die if they don't get human touch.
Right, right.
So I realized I should have asked for a definition of this. So what is intimacy even? Like how would you define that?
Yeah, I would define intimacy as a closeness. And this can be an emotional closeness. If I make myself really vulnerable to you and I tell you something that it's hard for me to say, maybe a secret I haven't shared with many people, that's intimate. So I do also appreciate that question because I think when I say intimacy, people's minds tend to go one way, which sex is a part of intimacy, but it's not just that. So closeness that could be mental, emotional, physical, spiritual closeness. That's what intimacy means to me.
And going back to the first myth about it's like you get to a certain age and you don't was that the first one you don't really
Yeah.
need it or
Yeah.
and you said there's some people that seem to be more confident and seek these things out for themselves as they age. You reminded me of this great book by Peggy Kleinplatz called Magnificent Sex. Have you read that?
Yes, I have.
Yeah, so her research and the big thing she consistently shows is that people that report and she defines specifically like what is magnificent sex, but people who are older are the ones that like raise their hand and say that they are in fact having this, and that is so fascinating. And that book is great. I recommend it to anyone. And that aligns too with the studies that show that people are happier as they get older too. They're happier, they're more content. So that all fits together. And so what do you think those two? Yeah, I'm curious about.
Yeah, I do. I do think it's correlated with happiness. And again, I know I'm stressing this a lot, but we see more intimacy in some ways and less types of intimacy in others. I'm not saying that everybody that's 90 is having intercourse. I'm not saying that. But people are getting more creative as their bodies change, find other ways to be intimate. And that can be really fun and exciting, silly. So I think all of those things lead to happiness. Closeness leads to happiness.
So, what are these creative ways that you speak of? Can you give some real life examples?
Yeah, sure. Yeah. I mean, so I really admire some of the clients I've worked with in the past who are brave enough to say, okay, maybe this is something I used to really love and it doesn't feel good to me anymore. My
Like
body's changed.
what?
Is this a PG than podcast or?
No, no.
Okay. Okay. So if we take a woman, for example, maybe she really loved penis and vagina sex before, but that's no longer comfortable to her anymore. Or maybe her partner isn't able to sustain an erection, so it's just off the table. So maybe they're starting to try toys together, and that's something totally new for them. It's not uncommon in heterosexual relationships that the idea of sex is just penis and vagina sex. If that didn't happen, you didn't have sex. I think that some older adults I work with are rewriting that script.
Mm.
And so I love to see that. It could be that. It could be doing massages to try to figure out, I don't like this type of touch anymore, so let's find what I do like. There's something called a body mapping activity that I sometimes do with couples. And I'll send them off and say, by the time you come back, I want you to have explored each other and tell me each person's top 3 spots. And it could be silly things like they really liked their earlobe rubbed or felt really good when I tickled their forearm.
Mhm.
And that's fun. I think we lose that very early. And I think older adults find that again. And that makes me really happy.
So it seems like a great practice. Very low, like low stakes, so to
Mhm.
speak. So how long does that take to do? I mean, I'm sure it could take any amount of time, but like, what do you recommend
Right.
for people
Well,
starting out? Yeah.
it depends on the couple or the person I'm working with because that body mapping can be done by yourself. You don't need a partner to do that, to explore that. But
Mhm.
I do assess a few things. I mean, if there's a trauma history, obviously we would take something like that slower, somebody's readiness to do that. Those would all be things that I would figure out. But I think if you have a partner and you're both motivated, that's a fun date night. Light some
Yeah.
candles, put on your favorite music. So I think that that could something that could be done rather quickly if you're motivated.
And you mentioned that could be done solo. And so tell us more about that because that seems very different than with someone else.
Yes.
And then what
Yes.
you're getting out of it might be a little different also.
It really is. And so I practice a type of therapy called solution focused. Most therapists resonate with a number of theories, and this is just one that I use. But I believe that my clients shouldn't be in therapy forever unless they choose to be. And some people like that maintenance therapy. So I normally will assign homework in between our sessions. And that's kind of, to your point, something that I would say is maybe, okay, we're going to meet in 7 days. Each day until we meet again, I want you to try something new related to touch. So maybe you've never gotten a pedicure and you're going to treat yourself to that.
Nice.
Maybe you heard about Epsom salt baths, but you never went out and got the Epsom salt. So now you're going to try that. I mean, it doesn't have to be huge things. You're going to watch a YouTube video about lymphatic massage and teach yourself how to do that. So I think that there are a lot of ways somebody can explore that by themselves.
And can you share, what do people come back to you and say after they've tried these things?
It's a mixed bag, and again, it really depends on the person's goal. I've had people say that was silly, and I don't think I got anything out of that, or I felt strange doing that, which is actually very helpful to me as well, because then we can dig into why and how were you raised, and what did your culture tell you about touch and intimacy, um, and also it might not be important to them, and that's okay too. And then I've heard people talk about it being life changing and feeling like they lost that sense of self. And now that they weren't able to have this type of sex, they thought they weren't going to have sex anymore. They weren't going to have intimacy anymore. So it's pretty cool to hear what people come back with.
Great. You made me think of, it's interesting how a lot of us like want to over intellectualize everything.
Yes.
Yet, if your dog runs into the room, you'll like jump on him and roll around on the floor and
Yeah.
then go back to like being like, but this is stupid, this touch exercise, like with my wife. Why would I do that? So it's like, it's so baffling sometimes.
You're so right.
Yeah. So I'm just wanting to dig in a little more to like the actual physical challenges that occur in aging that can impact sex and intimacy. And I'm curious of your stance, like for example, when there's trouble sustaining an erection. I mean, of course, if it's medically evaluated and that side is all addressed, like how do you approach that? And and I'm sure it varies, but yeah.
Yeah, yeah. And that is generally the first thing I will tell somebody is, have you spoken to a doctor? Because it could also be masking something really important to deal with medically, and that I'm never going to step outside of my bounds there. But in those situations, I try to assess there are other reasons mentally that it could happen. So if you're having trouble with erection, it could be related to anxiety, for example, performance anxiety, something we see a lot in sex therapy. It also could just be that your body is changing and that this is something that is more challenging for you now. There is a lot of grief and sadness in that for men. I think that there is a lot tied up in the masculinity of an erection. So it could just be processing that grief and sadness. But on the other side of that, there is creativity and innovation, and newness that my goal would be to work towards after we've processed that. What still feels really good for you? And what feels really good for your partner? And what are other ways that we can help you both feel those things? So that would be what we would work on together.
That's great. It seems like that's a big opportunity to reframe or move away from that sex is just, what did you call it? Penis and vagina.
Yeah, yeah. It's true, right?
Well, yeah, what I say is penetrative intercourse, which that could mean, I guess, different things. I can imagine some people are more easily open to that reframe and some maybe like does not
Yeah.
compute.
Yeah.
Because if you've had your whole life as a man of that's the model, like
Right.
that's how sex goes. It's all about that. And that's when we know the beginning and then when it ends. So I'm curious what are if there are clear barriers to that for certain people and you just have to like move on and not try to keep. Yeah.
Sure. I mean, and to your point, before I answer that, you are completely right. Yes. I used in that one example penis and vagina sex, but penetrative sex, because we know that all types of people are having sex. It's not just men and women. It's so that's a caveat there. But yeah, I mean, there are those people. I think in therapy in general, you have to be really motivated. You have to be as the client, you have to be very vulnerable, open, and sometimes you hit a wall on anything. But something like what we're talking about now, it's so ingrained, and it might be more painful for the person to let down that wall and accept what life is like not having that ability than to just keep it up and not talk to somebody. So certainly sometimes we get to that point, and I would just say we would talk about, what is your goal now? If that's not something you want to explore, then what is your goal?
Fair enough. Although that could be continually demoralizing for that person because they continue to have that challenge and maybe it's, this is also part of just aging. It's normal, right?
Yes. And just on that, I mean, I think that this is something we could do more of, all of us that work with older adults. There are great things about being young. That is one wonderful example, right? That's a great thing about being a young man. There are a lot of amazing things about being older that you don't have when you're younger.
Hmm.
So, while yes, there are things that you cannot do as you get older or are more difficult, I would really encourage people to think about what is so amazing about your life now that you didn't have when you were younger. That could be financial stability, that could be freedom, that could be more confidence. So I just think that sometimes this society pigeonholes people like, oh, you're older. I don't know. I just wish that we did a better job of that.
Definitely. And I mean, hormone like testosterone is decreasing as we
Yes.
age. And so there is this opportunity for like more of an emotional connection between the two, partners when one of them or both of them are men
Right.
as they age. And that's really can be very rewarding and fulfilling for people far beyond the fulfillment of the physical satisfaction that they had in their
Yes.
20s. And then you make me think of that book that I referenced earlier, but she talks about having a more expansive view or definition even of what sex means. And that's what you're saying, which again I think is really hard for us in this culture to grasp for many of us. So yeah, I'm curious if you could share like some more exercises or ways that you get people to like start these conversations.
Yeah. So, one thing that is very valuable for your listeners to look into, and I eventually will do it, I just haven't sought out the training that I need to feel most comfortable with it. But it's called Sensate Focus. That's Sensate. And essentially, it is a program where you take sex off the, sorry, penetrative sex off the table.
Hmm.
And it's really great for performance anxiety. It's really great for folks that are having other challenges, folks that are aging. And eventually the goal is to get back to sex, but it takes off a lot of that pressure and it encourages exploring and deep conversations, which are intimacy and are also knowledge. Because if you have been with a long term partner, you probably have fallen into a routine, and I would be willing to bet it has been a really long time since you asked them, does that still feel good? Or is there
Hmm.
something that you want to try that's different? Did you see something recently that was really interesting that you didn't talk to me about? So that would be an exercise that I would encourage. I also love the Gottmans. I could talk about them all day. So John Gottman is a researcher, a couples researcher, and his wife is an LCSW, I believe, like myself. And they have amazing research on couples that they've been doing for decades. I
Yeah.
think they can predict with 90 something percent accuracy if a marriage will end in divorce.
Hmm.
I mean, that's how long they've been doing it, but they have some really great questions and activities, and I think even games that you can purchase around intimacy.
Hmm.
So it can be fun. And that's what I want to bring up as well as some of this is going to feel silly. And I think sometimes the older we get, the more we move away from play and silliness. We feel
Hmm.
like we shouldn't do that. That's something kids do. I should know everything. There is something so beautiful and vulnerable about being silly around sexuality. Um, and I would encourage people to open yourselves up to that because I think you're going to be really pleased if you don't take yourself so seriously with this.
Yeah, that's great. It's definitely hard for some people. Some people haven't been playful in a long time in their lives,
Yes.
and they have a lot of hard things going on too. So it's a process to get there, but maybe really an important one to invest in. So the sensate focusing, how would one, if someone's interested, like find out more about that?
I can probably get you something for the show notes.
Okay,
For
great.
listeners, check out Dani's show notes, and I will be able to get something that kind of outlines what it is and probably some therapists who practice it.
Okay, great. I'm curious, do you see any potential future where, I mean, you said you have you're feeling encouraged, I think, by, some of your clients. And do you have hope that our aging adults are reclaiming intimacy and rewriting the story of what aging looks and feels like?
I do. I really do. And any older adult that is listening to this, number one, thank you for just listening because that already shows me that you're an advocate in some way. Keep talking about it, keep asking your providers about it. I've been invited out to retirement communities to discuss the topic, not as much as I'd like, but I know that is because there were some voices that were asking for that topic. So I really see more, I think we are getting more open minded, but the people who serve older adults will not be open minded if the older adults are not stressing the importance and
Mm.
asking for education on this and support on this. So I think we're getting there. I'm really excited. In the time that I've been doing this, about 10 years, I would say now is probably the quote unquote best time to be
Yeah,
doing this work. It could be a lot better. But yeah, I think we're making really good progress in this area.
that's great to hear. I'm curious, what are people at when you do these talks? Like, are they asking for something specific? And how do they go when you do them?
They go really well. I mean, it again, to reference that silliness, there is that silliness because a lot of the words that are body parts we have been told are like, oh, you shouldn't say. So there is kind of a little laughing when I say a word, and that's fine. I think that's good to talk about, to let ourselves to laugh and be playful like children. But I would say the questions, people are very interested in the health and wellness benefits, and they're really interested in specifically how do I apply what you're teaching me today? What resources are there? Where can I go to experience a good massage or something like that if I don't have a partner? So those are the type of things that we will generally talk about in one of those presentations.
So it's more like a basic overview, one like introductory
Yes.
conversation.
Yes. I That's all I've been invited for so far. I will say there are generally those few people that hang around after and will ask a one-on-one type question that's very unique to their situation. And I appreciate those people. I think that's brave to do that. No matter your age, to talk to somebody about your sexuality isn't easy.
Yeah. And it seems like just like anything, the more you talk about it, it loses that tabooness and yeah, heaviness and
I can't
needing to
even tell you.
giggle.
It does
Yeah.
not phase me. Like, I love other people's reaction to it because I see it's hard. It is hard for them to talk about. They feel uncomfortable. They're approaching me. They're kind of, maybe they're blushing or maybe they're talking around it. There is nothing I have not heard at this point. So I really welcome the discussion. It does not make me uncomfortable. So I'm really open to people coming to talk about it.
Great. I'm sure they really appreciate you doing that. Now, so shifting a little bit, so I'm an Alzheimer's specialist physician, and in terms of a lot of what has been talked about, and in terms of Alzheimer's and dementia related to sex, unfortunately, has had to do with these unwanted behaviors or
Yes.
things that were considered inappropriate or out of character that are distressing to everyone around. While that's a hugely important topic and there's so much that should be a whole other talk, there's people who have a disease, say for example Alzheimer's, if diagnosed early they may have 10 to 15 years to live. So there's a lot that's happening and changing and thinking, changing function, changing roles and relationships, and there's a lot to that. I could see there's a lot of ways that you could come at this to help support individuals and couples and families in this area. Now, I will admit, I wasn't trained. This isn't talked about like in medical training and residency, like at all, except for what I said, these unwanted behaviors. So I didn't, when I worked, in my memory clinic job previously, I didn't bring this up. And I think partly it was because I don't think at the time I knew what to do with the information, and I don't know that I knew that I would know how to help people. But I think, having been doing this long enough, people just appreciate the question
Yes.
and they don't expect you to fix everything. But for some people, that might be the most pressing thing, like the lack of touch and intimacy. And there might be somewhat of a simple fix, potentially. And I'm curious, just let's see, what are maybe I'll just keep it open. Anything you want to say on that topic?
Yeah, thank you for asking about this. I want to acknowledge it is a very sensitive topic in many ways, and I am probably going to say some things that some people will resonate with and some people won't. And I don't think that I can paint with a broad brush on this one. So I think about the partner of someone with a dementia diagnosis, Alzheimer's diagnosis, and you have to let yourself grieve. That's the first and foremost. And I'm not minimizing that at all. I do think that if you can try to see this person that you've loved and you've had a life of intimacy with as kind of like dating, dating, getting to know this different person. They might have always loved this and now they actually really don't and they like this and that's new. I think that can be a powerful reframe
Mm.
in terms of what I see in the facilities, and by that I mean like hospital systems, retirement communities, memory cares. I wish that, like we talked about with the benefits of intimacy, touch, orgasm, things like that. You might see somebody who's sundowning and they're not sleeping well, their circadian rhythms are like, but they're being stopped from physical touch, like by themselves, like masturbation.
Mhm.
And stuff like that gets me thinking, like, if that could be encouraged in a way that's safe and respectful and maintaining that person's dignity, like, would they sleep better? Would their mood be better? All these things that we talked about.
Mm.
So I agree that there's so much to still explore. And that's why I think we need to have these conversations. Something that I always love to reference, and I have referred to occupational therapists so many times for this. They are the leaders, in my opinion, in our field in healthcare for being open to sexuality. I think it was 1986, they added sex as one of their activities of daily living. And that to me is,
Nice.
I wasn't even born in
Blown tea.
1986. That's just so cool. I think bringing in professionals that are willing to have this difficult conversation, care planning, because everybody's unique and different. I just think I think we're letting people down, partners and people living with dementia diagnosis.
Yeah, absolutely. Just like everything else with these, um, the ideally these conversations would start early, and just over time people would adapt to what's happening, and they would understand. They would have that framework of like, okay, well, now this is the status or situations. I have heard stories. I have heard from patients and families, like couples, that what you said earlier, like say someone used to be kind of one of the partners in the couple used to be pretty buttoned up and reserved, and then suddenly they're up for going dancing, and like their partner like loves dancing, so they're suddenly like it's really it's really working for both of them, which that's really special and beautiful. And so, and that could be like the highlight of their whole relationship, frankly, the fun that they have while dancing or something similar. So those things are absolutely a possibility.
Just have to thank you for that story too. I wish we also did more of what you just did there, because when we hear stories about Alzheimer's, you don't hear those stories. Those aren't the ones that people tell. And not saying that anyone would ask for that diagnosis, but I think that that brings a little hope and a little lightness. And I think it's powerful. So thank you for sharing that example.
Yeah, it's interesting. I think in general with these, when people make comments, I've heard people say like, or I've heard family members recount stories of like their person said, like, this is just in general. They were like, this is the best time of my life.
Hmm.
And I think people, like, generally the public, like, they don't that does not even process, like they can't believe it because it's so unwanted for them to have these diseases, or their conception or perception of what it's like to live with these diseases is so frankly wrong about like how bad it is. And whereas people can live really amazing full lives, and some may have new and wonderful experience, many could have new and wonderful experiences if they open up to it, but also the environment and the system supports that and encourages that. And I just wanted to go back to, this is like a sensitive topic, or so to speak, but this topic of like people self-pleasuring in say supervised living situations. I thought about this recently, how some people, they're doing that their whole life, maybe every day,
Right.
and then suddenly they're being watched 24/7, and they don't realize, like, because they have severe dementia, that they're in the main room, and they're demonized after that. And we can't truly know what the motivation is, but I'm sure that the majority of time it's not intended to be inappropriate or to do anything malicious. And it's really sad what happens. And instead of trying to find like a smart solution, like occupational therapists are so great at, sometimes people get kicked out. Like it just doesn't like fit in.
Yes, and that is
Yeah.
the thing,
Yeah.
making sure everyone feels comfortable. And there's probably a space that that person could go if anyone took the time to make it look like their home, or there's so many
Yeah.
things. I know you've seen like the decals on a door that make it look like a bookshelf so somebody doesn't enter that room. I mean, but we don't dedicate the time to it. We just, to your point, write it off, transfer the person out, and
Yeah.
yeah, it's really tough.
Yeah. But I go back to what you said about there's hope. And I think the younger generations generally are more comfortable just with these topics. And
Yeah.
And hopefully that's changing. So any thoughts about when you have family members who are trying to navigate concerns about intimacy and it feels taboo or confusing in care situations, which kind of relates to, that example I just mentioned, but any recommendations for them?
You're talking about adult children?
Yeah.
Yeah. So, well, the first thing I would say is let's speak of the person themselves. That's the older adult that's listening to this. Just like you are planning for other things, maybe you're talking to your care partner or your children or your lawyer about your finances and what you would want medically in the event of an emergency. I think it's very valid to talk to them and say, hey, here's a big part of my life. Like, I really enjoy intimacy with my wife, or I really enjoy physical touch. I would like that to be a part of my life later. I think that that is important because so often you'll see adult children, and I don't blame them. It is uncomfortable, and if their parent has a cognitive issue and can't tell the child, "Actually, I'm okay, this is what I want," it's hard to suss out.
Hmm.
But I would say if that is important to you as a listener of this podcast, have that conversation. For adult children, I would really encourage you to look at why you're feeling uncomfortable, if it's something about your parent, if they there are things that we can look at with someone with cognitive impairment, like do they seem happy, right? Are they expressing any pain or all those things? If you're not seeing that and the person seems really happy and enjoying themselves, and it's you that feels uncomfortable and you that thinks it shouldn't happen anymore, I would just encourage you to look at why that is. And it's hard to do, but it would be a real act of love to do that, to look at what's happening for you. And for a
Yeah.
care partner as well, I know I would assume that you've seen what I've seen, which is somebody with memory issues moves into a memory retirement community, and they're seeing somebody else in that community, and their partner, their lifelong partner, is going in and visiting them and
Mhm.
seeing them kissing or hugging or cuddling with another person. That is heartbreaking. I am not minimizing that. I think that that person, if you can make space because you love your partner so much that you can make space to let that happen, take care of you, talk to a therapist, find a support group. We're
Mhm.
not saying it's easy, but it does happen, and you should feel supported as a care partner too.
Yeah. So there's help out there.
Yes.
And as much as it can be so uncomfortable to bring it up, it could really lead to a breakthrough, even for that family member who's witnessing that. And then you just thank you for all of that wisdom. One thing you gave me this idea, which maybe this already exists, but there should be, ideally, and I'm hoping that with Brain Love we kind of start this or, add to this that's already happening, but have conversations early with your family, with your loved ones, with your spouse about like what are your values, what's important to you, and
Yes.
when you get to be in those later stages, like what do you want? And this helps your family so much to honor those things. And so if you could define like what's your sex and intimacy directive and say what you just gave that example, this is really important to me. And then your spouse says, okay, I agree to continue to make this a priority and make this happen for us, if at all possible, if it's comfortable and safe for all of us as the disease is progressing. And that the person who has the disease can feel like relief,
Yes.
that at least they've made their values and their desires clear, in that in other ways, and that their family will do everything they can to uphold it. I mean, that's all we can do. That's all the control we can have. Well, thank you. Maybe I'll just any last tidbit of wisdom or for people who feel like their sex life is behind them, that they're too old or they have too many medical issues or anything like that. Like, what would you say to
Yeah.
them?
So I will give a homework assignment as I am wont to
Oh, I
do
love
in
that.
my therapy practice. And I would say take out your journal, your notepad, whatever you can write on. And I just would like you to reflect on where are you receiving physical touch in your life? Is it enough physical touch? And what is one thing you could try to add? Just it could even be one time to increase that amount of physical touch or intimacy. And I just really do want to stress because I'm very excited by how much people are into wellness lately. And I do just want to stress how much intimacy, physical touch is a part of wellness. So if you're feeling inspired by that and you're reading lots of books and implementing different things, please make space for this as well because it is very good for your body and your mind.
I love that. So a physical touch audit, so to
Yes.
speak,
Yeah.
with homework. Love it. Wonderful. Well, thank you so much for being here, for your time and expertise. And we will have all these things in the show notes, and maybe we can get a little review about the body mapping, what that is, or that exercise for people. That would be great. Did you say there was maybe a little gift for
Yes,
listeners?
there is a little gift. Our listeners that are based in Pennsylvania and are looking for teletherapy services, happy to partner with you and to give 15% off for the next month after this podcast is released. So that will be in the show notes where to find me if you're interested in doing some sex therapy work.
Oh, yay. Thank you so much. I hope you have a lot of the older generation, especially reaching out to you.
Yeah, I hope so too.
Okay. All right. Well, thank you everyone for listening. This has been a really exciting, important topic, and I hope to have you back sometime, Katie.